The next project is a project from Dr. Yu at the University of Michigan, looking at the role of this gene FKBP5 in the MAGEL2 mice. So this is a great example of how a very basic science project can develop into a therapeutic project. So we funded Dr. Yu along with her mentor, Dr. Malcolm Lowe, I think 2 years ago, to look at what are the differences between a PWS mouse brain and a typical mouse brain. And they did that in very detailed, using all of the most advanced genetic approaches, and found this one pathway overactive in PWS. So this FKBP5 is overactive in the PWS mouse. And again, this is a pathway that's important in stress response. So that kind of harkens back to Dr. Fontaser's project. And they hypothesized that this overactivity is really a necessary step for the development of the PWS characteristics. The good news about this pathway is there's already a drug that reduces the activity. And so in this follow-up project, Dr. Yu is going to test whether, if you reduce the activity of this pathway, if you recover some of the or improve some of the abnormalities in the PWS mouse. So we're excited about this study because they did a great job in their first year of funding. They came up with this potential pathway, and now they're advancing it to looking whether there's translational potential. This is, again, a young investigator who has been working with Dr. Lowe, who is one of the leaders in the field and has been for many years, but it helps set up her research project with the long-term goal, again, of providing preclinical rationale for either advancing this as a potential PWS therapeutic or deciding that it is not the path to go down.